We anticipate that today's session will leave you well informed ahead of the April 30th launch of the Quality Improvement Reporting and Analysis Platform, also known as QI-RAP. Next slide, please. Of note, the webinar is being recorded for future reference. It will be accessible on the Health Quality Ontario website under the Health Links section. The slide deck will be available in both French and English once it has been translated. To ensure good sound quality, all participants have been placed on mute. However, we do encourage you to take advantage of this time by asking questions and seeking clarification as needed. To ask a question, please open your control panel by clicking the orange arrow to the right of your screen. From there, you can post questions into the chat box feature. We'll look forward to answering your questions at designated times throughout the webinar. Next slide, please. You will hear a few different voices on the line today. Our panel includes myself, Jennifer Raitt, who's a Quality Improvement Specialist with HQO. We have David Lamb, the Manager of Policy for the Transformation Secretariat at the Ministry of Health and Long-Term Care. We have Sandy Seaman, who is the Manager of Quality Improvement Spread at HQO. James Mayer, who's the Project Coordinator. And we have Kamal Sabra, Sue Jones, and Terry Donovan, who are also Quality Improvement Specialists around the province. Next slide, please. During this webinar, we'll introduce you to the context and functionality of QI-RAP. We'll also provide you with clarity regarding the change in reporting expectations and highlight that there is a mandatory expectation to submit Q4 data by May 8, 2015. During this webinar, you'll also learn how to use QI-RAP. To facilitate your learning, we'll lead you through a live step-by-step demonstration on how to log in, submit data, and view reports. From there, we will discuss the supports available to you to ensure a smooth transition to QI-RAP. I'm now going to invite David Lamb and Sandy Seaman to provide you with an introduction to the QI-RAP platform. Welcome, David and Sandy.
David, are you there? I'm guessing that it's Sandy Seaman speaking. I'm guessing David's been delayed. I know that he wants to come onto the call a little bit later, so we'll hear from him when he's available. The launch of QI-RAP is an exciting time for all of us. Not only will data be readily available to all HealthLink stakeholders, but now we can start to align data with best practices and innovations arising from the HealthLinks. You'll see in a few moments that the platform is easy to use. And by that, I mean that it is simple to enter data, and as soon as the data are entered, reports are available for viewing by HealthLinks, by the LINs, and by the ministry. And when we have a sufficient number of data points, we can start to apply run chart rules to demonstrate statistical improvements. The launch of the data platform will be complemented by resources to accelerate the adoption and spread of best practices and innovations. Health Quality Ontario is collaborating with the LINs and the HealthLinks on the identification, evaluation, and spread of innovations. Our knowledge transfer plans include development of guidance documents and establishing a HealthLink community of practice. We've already started this process with the topic of coordinated care plans. In February, we hosted focus group meetings and have subsequently drafted a guide to coordinated care planning best practices. Currently, we're vetting that draft with HealthLinks in preparation for a June publication. But before the guidance document is published, we will launch the HealthLink Communities of Practice in May, starting with a webinar addressing the key practices for successful coordinated care planning. Stay tuned for the date. Finally, I want to ensure you that you are connected with quality improvement specialists across the province. Their names and contact information were circulated earlier this month with the announcement of these webinars, but we'll post that information later on in this webinar as well. The quality improvement specialists are available to work with your HealthLink intensively when you're a new HealthLink ramping up your activity, and in an ongoing fashion in support of spread of best practices and measurement. The quality improvement specialists are also a resource to you and your HealthLink during this period of QI-RAP onboarding. I'll pass you back to Jennifer now.
Thank you. We now understand the context of QI-RAP and have heard about how the data will be used to support sharing across the province. At this time, it may be helpful to clarify that many health links are already collecting health links indicator data regarding the number of coordinated care plans initiated and the number of patients that are now attached to primary care providers. The data collection process and submission schedule will remain the same. The difference is in the tool that's being used to submit the data. Currently, most health links submit data using this reporting tool or a similar Excel spreadsheet-based reporting tool. As of April 30th, the tool used to submit the data is changing to QI-RAP. Next slide, please. So to clarify, HealthLink's indicator data for Q4 and all future data must be submitted by QI-RAP. However, it's important to note that the change only involves the HealthLink indicator data. Financial and qualitative information will continue to be reported to the Ministry using the Excel spreadsheet that was distributed on April 13th. Next slide, please. I'm now going to pass you over to Kamal and James, who will take you through a step-by-step demonstration of QI-RAP. They're going to show you how to log in, enter data, and review reports. Later in the presentation, we'll review some frequently asked questions and open it up to you for questions. Kamal and James?
Thanks, Jennifer. So for this demonstration, James and I will show you some key functions of QI-RAP. And during the demonstration, James and I will go back and forth in a question and answer type format. We also wanted you to know that the data that we're showing you is fictional, so you might see some familiar names of LINs and health links, but I just want to reassure you that the data is fictional and we're just using it for demonstration purposes. If you have any questions while we're showing you QI-RAP, please enter it in the chat box, and Terry will let us know when a question comes in, and we'll try to answer it while we're doing the demonstration. If we don't answer your question during the demonstration, we'll try to summarize all the questions at the end and give you the answers.
Thank you, Kamal. So I guess the first thing I'm going to do is I'm going to show you how to first log into QI-RAP. And to do that, you first have to visit hqontario.ca, our main website. After that, you'll come across 6 headers at the top. You'll go to the login. From there, you'll be directed to the QI-RAP login portal. You would enter your username and password. The username is the email that you sent in the bulk registration form. A temporary password will be sent to you shortly thereafter this webinar from HQ Ontario. After you enter your username and password, you would press Login. You would be directed to where you would need to select one of your initiatives. When you log in, you'll only see the HealthLink initiative. I see 5 initiatives because I'm registered to more than one health link.
Can you increase your screen size a little bit? Sure. Perfect. Thank you.
So just to continue with this demonstration, I'm just going to be changing browsers to our testing site to demonstrate the functionality of QI-RAP. Okay. 1 second, Kamal.
No problem. So as James is just going to our testing site, just a reminder, just chat in any questions you have in the chat box.
Okay, sorry about that.
Perfect, thanks, James. So it looks like when you log in, there's 3 tabs under the Measures tab on the left. What are those tabs for?
That's correct. So the very first one you see is the Data Entry tab, and this is where you would go to enter your data for quarterly. The next one is the View Report. The View Report tab is where you would go to view the aggregate data at different systems level. The last measure, Custom Measures, is currently not available, but will be available in the future to allow individuals to create their own measure for tracking. The Custom Measure function will only be available to those with data entry access.
Okay, so could you explain what data entry access means?
Yes, of course. So the data entry user is able to enter data, view reports, and view all data that was entered for a measure. The view-only user is able to view reports and view all data, but is not able to enter any data.
Okay, so if I have data entry access and I need to enter my data for the last quarter, where would I go?
Sure. So under the Measures section, you'd click on the Data Entry tab. From there, you'd be taken to a drop-down box. You would select your HealthLink team from the Health Certifier drop-down box. After that, you would select your HealthLink. In this case, it's a Test HealthLink. And then once selected, you would press Go. After you press Go, you'll be directed to the Change Area section, and this is where you would select measures and enter your data. Right now, you see 3 measures. The first measure being primary care. The second, which is reserved for future measures. And the third, coordinated care plans, the third measure. For example, if you're going to enter data for the coordinated care plan measure, you would click on the measure and expand the field. After it expands, on the far right, you would see 3 icons. The first icon is the Add Data icon, and this is where you would go if you're a data entry user and you wanted to enter data for this measure. The middle one, for the Run Chart, this is a function that will be available in the future for HealthLinks. The third icon is the View All icon. And this is where you would go if you want to see all the data entered for each collection period for the corresponding measure. It also allows you to edit your data.
Okay, so if somebody has view-only access, will they see all 3 of these icons?
Good question. No, they won't. So if you were a view-only user, you would only see 2 of the icons. The Run Chart icon, which will be available soon, and the View All. You will not be able to see the Add Data icon.
Okay, so if I have to enter my data, then I would click on the icon that's called Add Data?
Yes, that's correct. And I'll demonstrate that right now. So if I wanted to enter data for the coordinated care plan measure, it's already expanded. I would click on the Add Data icon. After that, the Add Data Entry section would pop up. You'll see a description for the measure, instructions for the user, the start and end date. So to enter quarterly data, I would first select a time period you would want to enter data for. So QRAP is designed to enter data monthly. It will accumulate the data to a quarterly level. However, it's not expected for HealthLinks to enter data on a monthly basis. So to enter data for a quarterly basis, choose the last month of the quarter as your start date, and the end date will auto-populate for you. So for example, if I wanted to enter quarterly data for the quarter of January to March, I go to the start date, and I would select March and press Done. The end date would automatically populate. This resembles the current process, and you have until the end of the month following the quarter to enter your data.
Okay, and then can you tell me a little bit more about the annotations field?
Of course. So the annotation field helps tell you a story for your data. You can include any additional information that you'd like to note on this line chart. For example, if CCAC was on strike, that may influence the number of coordinated care plans for that quarter, and this is a good way to highlight that on your line chart. So I could just manually type in CCAC on strike, and then go into Target and Actual and save it. So after I would enter my annotations, I would enter my target amount for this measure, the actual value, and then press save. And this would save that data entry for this measure.
So James, how come there is a save button and a save and new button?
Sure. So the health links will primarily use the save button when entering their quarterly data. The save and new button is used when entering more than one data point. For example, if I was a health link and I was entering historical information, this would be a good process because I wouldn't have to reopen the data entry section for each historical data point being entered. Also, if I wanted to not enter this, I could either hit cancel and it would close this drop-down box without saving this data entry, or I could just manually delete it and enter the amount that I wanted. Just a key tip, Kamal, once you save your data, you cannot delete this entry. You can go back and edit it, but not delete it. If you did make a mistake and needed to delete a data entry, you would need to contact our help desk to do this. The reason for this is to protect the integrity of the data set.
Okay, so even if I do make a mistake, though, I can edit the data. Could you show me how to edit it?
Of course. So I'm just going to cancel this because I don't want to enter any data right now, and press yes. So if I wanted to edit data that was entered for the coordinated care plan measure, I'd go to the far right and do the View All and click on the View All icon. After that, I would see all the collection periods and actual and target data entered for this measure. So if I wanted to enter the January 1st collection period, the 20 and 23, I can manually click on this and highlight the row, and at the bottom left, you'll see 3 icons. Add new row. This resembles the add icon on the previous page, the edit select row, and the run chart. So I wanted to edit select row. Like the data entry, it will bring up the same description, instruction to the users, the start and end date that was used for this entry, and the fields, which were the same, the target and the actual. So I can manually just change this. Say if it wasn't 20 as my target, I could change this to 15. And if my actual wasn't 23, I could change this to 25. And I would press save.
Okay, so thanks. That's really helpful that we went through the coordinated care plan measure. Could you show me the same thing for the primary care measure?
James, we have a couple questions that before we go any further. So there's a question, why is the start date the same as the end date? So it was showing March in both start and finish.
Good question. So the start and end date are the same, primarily because they're just entering quarterly data. So they're not entering over a span of different months. So if I was entering quarterly data for the January-March, I'm only entering data, all my data for March. That's why the start and end date are the same.
Okay, and so do we have to enter data for each month of the quarter? And I think
you can do that. So health links can enter their quarterly data on a monthly basis. So I'll use the same quarter example. So January, March. So I could enter all my January measures by just selecting the start date for January to January, and then February, and then March. And it would accumulate that to a quarterly value. But health links don't need to enter on a monthly basis. They can continue with the same process and just go into QRF once and enter all their quarterly data by just selecting the end of the quarter of March.
Great, thank you.
You're welcome.
Thanks, James. So just to review then, the primary care measure, would I just access it the same way the coordinated care plan one?
Yes, that's correct. So to go back to the screen where I saw all the change measures, I go to the top and click on Go Back to Change Area. So if I wanted to enter data for the primary care, I'd click on the primary care, and the drop down will be the same. You'll see 3 icons. If you're a data entry user, I would click Add. Like the coordinated care plan measure, you'll see the description, instructions to the data user, the start and end date being the same, I would select the last month of the quarter to enter my data. I can enter any annotations, like the one I used before, CCAC being on strike. And then here you would enter the fields. I just want to make note, so in this case you do see 3 sets of fields. As a health link entering data for this measure, you only need to enter 1 set of fields. If you do have information to enter for the other fields, you can enter them, but you only need to use 1 set. So if I only had the first set of fields being appropriate to my health link, I would enter the target that I have, the actual, and if these are not, if I don't have any information, I would just fill out 0 for each of them. To enter data, you do actually have to put a whole number in each of these fields to continue. So if I only have the very first set of fields to enter data, 20 and 30, then the rest will just be 0. The formula on the bottom, you do not need to worry about, Canal. It automatically populates, and the formulas are based off what was entered in the field selection.
Okay, sounds good. And then I guess I just hit save.
That's correct.
Okay.
If you're entering historical data, the other way you could do it would be to save and new.
Okay, perfect. Could you quickly show me the reports that I can view once I've entered my data?
Okay. So now that you have data entered, so you can view reports, I'm just going to cancel this. Over on the measure section under the data entry, you have view reports. This is where you'll select the 3 reports that will be available for yourself. Right now you do see more reports. These reports will be coming later. So the very first report that will be available is the health link report. So just to give you other information about the health link report, Kamal, the health link report provides the user with the ability to see data that they have entered for their particular health link or any other enrolled health link that has entered data. So to generate it, I'm going to select it from the drop-down and then press View. So this is what you'll see. So the flow of selecting parameters, I'm just going to say this asterisk on the side means this parameter is required, and you cannot generate the report without selecting it. So the very first one is the LIN. Just to go back to what you said before, these are all test data that was created just to show the functionality. So I'm going to select one of the LINs. All health links within this test LIN that have entered data will appear in this health link box. In this case, you do have to enter the health link twice. So whatever health link that you entered here, you'd enter it again, and this is just specifically for this report. So start year, this is unique to all health links. Each health link has a unique start year, and this is the date where they received operational funding. So topics, what we saw earlier, that's where we saw the coordinated care plan and the primary measures. In this case, since data was not entered for the primary care measure, it won't show up here. Only measures where the health link has entered data. So I'm going to select the coordinated care plan measure, topic. There was only one measure, the number of coordinated care plans. There's going to be 2 fields, the target and actual, and this is the amount that we entered when entering for this measure. And the measure output could be raw or cumulative. So just to explain what these differences are, the raw shows the value of the field as entered. Cumulative shows the sum of the field for all reporting periods up to and including the value for a given month. So just to give you an example, Kamal, if data for a field was entered from January 2014 to December 2014, then the cumulative value for March 2014 would be the sum of the values for the field from January to March 2014. So I'm going to select raw. Quarterly reporting. In this case, since health links are entering data on a quarterly basis, their reporting frequency usually will be quarterly. Visibility, this is related to annotations, and I'll explain. So when you have this selected as none, two things will generate, the data table and then the line graph. When visibility is none, annotations won't show visibly on the graph line. There'll be a green dot for any points that do have annotations, and if you hovered over the green dot, the annotations would show. If you select annotations, they will just automatically show on the line graph. So I'll select none just to demonstrate the hovering feature. The start and end date is automatically defaulted to all the data that has been entered from beginning to the latest data point. If I only wanted to see, say, the data between March 2013 and April 2013, I can manually adjust the start and end dates to do this. After all the required parameters with the asterisks have been entered, I can view the report. So in the field selection, since I checked both the target and actual, those are the two that appear on the line graph. If I only selected one, only one line graph would generate, but both the target and actual would still appear in the data table column down here. The annotations, the first one, TTC, Toronto CCAC on strike from January and March, over here, it is represented by a green dot, meaning it has annotations. So if I wanted to see it, I could just put my mouse over and the annotation will show. The direction of improvement indicates the preferred direction we want to see our data points. So up, we want to see the amount of coordinated care plans being increased over the course of our data. All the quarters that have been entered data for this measure are shown on the side with the amounts for both the actual and the target. If there's more than one page, you can use the pagination bar if the data entries were longer. You could also print this report. A PDF file would be saved and you can manually print it. You could also export the file in number one of these different softwares, Word, Excel, PDF. Is there anything else, Kamal, that you want me to explain for you regarding this report?
That sounds great, James. So it sounds like the HealthLink report will show the data in the graphs for one particular HealthLink, whether it's my HealthLink or another HealthLink. I can see one particular HealthLink at a time. Is there a way to see multiple HealthLinks on a graph?
Yeah, so that would be our other report, the LIN report, which will be available. And this compares HealthLinks to each other at a rolled up level. And for example, if I wanted to compare all HealthLinks who have entered data for a LIN or multiple LINs, I could do that with this report. So to generate that report, I'm just going to close this pop-up. From the select drop-down box, I'm going to click the LIN report and then click the view. You'll notice the parameters are a little bit similar to the HealthLink report. All required parameters are marked with an asterisk, and the flow of entering parameters is the same. You begin from the top, and it goes from left to right, and then top to bottom. So the first required parameter is the start year, and this is unique to all HealthLinks. So I'm going to select one of the test start years that we've created. All HealthLinks within a LIN that have entered data for the start year will appear in this drop-down box. So in this case, two test LINs that have data. I'm going to select both. Since I selected them, the HealthLinks are automatically selected in the next parameter. If, however, I didn't want to do that, there's a custom group one, and then I can manually select the HealthLinks myself. After you select the HealthLinks, you would select a topic. We have, in this case, coordinated care plans, the future measures, and the primary care. So I'm going to select one of the topics. Only one measure appears for this topic. Unlike the HealthLink, you can only select one field. So I'm going to show the actual amounts, values entered for the coordinated care plan measure. The measure output, you can either select individual or health link summary. If I select individual, the line graph will show both the data entered for both test lins. If I selected summary, it would add up both data entries entered for each of those lins for each quarter, and it will plot the lin summary. So since the measure output was individual, each of the test lins get their own data point. Each of the test health links get their own data point, both test 1 and test 2. The quarters that are entered, so for January and March, the first health link entered 279, the Timmins one, 251. The health link summary, 530, adding up, and the proportion represents, so if you had a lot of health links, and only, say, if you had 5 and only 3 out of the 5 entered, the proportion would reflect that. So if I change this measure output, the health link summary, only the third column will get plotted on the line graph. Like the health link, the direction of proven is showing that we want it for up. You could also print, if there was more than one page, if the data table was quite long, you would go through the pages here. You can also export the data the same way.
Sounds good, James. So it sounds like the health link report helps us view each individual health link. The LIN report helps us look at multiple health links. And so I'm guessing the provincial report will let us look at multiple LINs at the same time.
Yes, that's correct. But before we go on, Kamal, there's just a question. So I'm just going to turn it over to Terry.
Okay. So we have a question. If someone forgot to enter data for a quarter but included it within their next report, how would that be reflected in the cumulative report?
So if a health link didn't enter data, they could definitely enter it as historical data, and then if they went back and they generated a report for that time period, it will get reflected then. If there was no data entered, it would just be null. In this case, say if Timmins didn't have any data to enter for the January March, the proportion would be 1/2, and it would just be blank. And then the health link summary, this one, if these were the only 2, it would just show 279. So down the road in the future, say 2 months from now, this test health link entered it, and I regenerated the report and say they did enter 251, it will now reflect that change.
Great, thank you. So that's it for questions for now.
Okay. So Kamal, regarding the provincial report, that is correct. So in order to generate the provincial report, like I did last time, I'm just going to close the LIN report. I'm going to go from the drop-down box and select the provincial report, and then click View. So I would first have to go from the top left. The first required parameter is start year. Like before, all the start years will be available. I'm going to click 1. In this case, only 2 test 1s have entered, and all LINs and health links who have entered it will appear. So I'm going to select both. The topics that they have entered data for would appear. And then select the measure. Like the LIN report, you can only select one field. So in this case, I'm going to select, I want to see the target values for the coordinated care plans this time instead of the actuals. Like the LIN report, you have the individual LIN and the LIN summary as the measure output. I actually want to see on the line graph both of the LINs, so I'm going to do individual LIN. But in this report, I'll also demonstrate the LIN summary as the measure output selected, and then the date range. I want to see all the data that has been entered for these. And once all the parameters are filled out, I'm going to view report. So for this measure, it's showing all the health links aggregated to a LIN level that have entered. So the first quarter, January, March, the number of coordinated care plan target values totaled 82. and then for the other LIN, 63, the LIN summary, 144, and the proportion, since both, it's 2 to 2. So if I just wanted to see the LIN summary, which is this third column right here, I could change it. I could just change it to the measure output, and then view report. And now it's going to plot the LIN summary. So if I had more than one LIN, and I didn't want to see them all on the graph, say 5 or 6, this is a good way of showing some at a summary level. Like for the direction of improvement, shows all the data that's been entered. In this case, there's a total, and the LIN summary total. And like the Health and the LIN report, I can export the data and also print it. Is there anything else, Kamal, that you want me to explain for you?
Thanks, James. That was great. Maybe we can pause and see if there were any more questions on the chat box.
Of course. Terry, were there any more questions?
No, no more questions at this time.
Perfect. Thank you
Thanks.
all.
Thanks. So, James, once I've finished with QI how would I log out?
Sure. So to log out, I'm just going to close this report. In the top right, you'll see Close Window. I'm going to first click on that and press Yes. It'll take me back to the portal, and then at the top where we logged in, there'll be a Logout button.
Perfect.
Slow, but
Okay.
it basically
That's
brings
okay.
you back to the main website after you logged out.
Perfect. Thanks, James. So I think David is on the line, and maybe we can turn it over to David if you had any additional comments you'd like to make before we pass it over to Sue.
No, I did want to just say thanks to everybody for showing up this afternoon to go over QI. I think it's really, for us, I want to be clear that we understand that this is very much a transition phase over the next couple of quarters, and that we deliberately look to start in Q4 so we could get people familiar with the QI app as a reporting tool. And certainly I hope, from what I can see here, it will be very helpful not only to us here at the ministry as we look to try and advance the HealthLinks model and to work out what needs to happen in order to be able to advance it, but also I think for HealthLinks themselves and the LINs themselves to get a good sense of progress. Clearly, as I say, it'll be a little bit of working with this particular tool and then certain information continuing to be reported to the ministry, the financial information, that type of thing. But using this tool, leveraging this tool, I think will be extremely helpful and will ensure that that your HealthLinks will have a good sense of the future and the progress. If anybody has any questions about the ministry side of reporting with respect to the financial, then obviously they know how to get hold of me, and they're more than welcome to give me a call. But as I say, I think that this, as we move forward, we'll continue to work with this so that this becomes the norm.
Thanks, David. We'll hand it over to Sue to continue with the slide deck.
So thanks, Kamal and David, and thanks for Kamal and James for that demonstration. We are on slide 9. So while testing the program, we have found that there are some tips and tricks and would like to share a few with you. We've also created a document that captures the tips and tricks and some frequently asked questions. This will be a living document, and we will add the questions and answers to the frequently asked questions document as we move through the various webinars planned, and also once the users start entering data and viewing reports. In the Data Entry tab, you will have seen that data cannot be overwritten. However, you can edit the data using the Edit function on the screen, and this information will also be available in the user guide. As demonstrated previously, all fields that have no value when you're entering your data require a 0 to be entered to allow calculations to be completed. And a tip and trick under the Reports tab, so when viewing a report and you wish to change one parameter, just click the View Report button again to refresh the report. And a really quick way to clear all the fields if you need to enter new information is to hit Control, hold it, and hit F5 on your keyboard, and that'll clear all the fields and allow you to enter a new set of data. The next slide, please. So as the summary, oh, sorry, just 1 second here. Oh, here we are. So as demonstrated, there are a variety of different reports to be viewed, and your access will actually define which reports you'll be able to view. The reports available currently are the HealthLink report, the LIN report, and the Provincial report demonstrated. The rest of the reports will be coming later in 2015. Next slide. So we've referred to the user guide several times throughout our presentation. This guide will be available to anyone who has been set up with a login access with a username and password. The user guide will include a step-by-step directions from login, and if you've forgotten your password as well, it'll walk you through that, and also data entry and viewing reports depending on your access. We've added screenshots within the user guide to help you walk through the guide, and it coincides with the database, the QI wrap database. If anyone has any technical difficulties, we have provided an email address that you can report your problems to, and someone from HQL will respond within 1 business day. As referenced, there is a frequently asked document that we've created to help troubleshoot, and we understand that people may have a few questions along the way. So we created a couple slides just to go through and some of the frequently asked questions we thought might come up soon. So the first one is, do we need to change our current data collection process? And the answer to that is no, just the reporting tool has changed. So instead of capturing your data for the indicators on paper, they will now be entered into QI wrap. Next, the new who needs data entry access and who needs view-only access. So this is your decision. As a HealthLink and LIN, we suggest that every active partner within your HealthLink, LIN, and the ministry should have view access, but only a few should have HealthLink data entry access to keep your data clean. And the third question, what will happen to our past data? The 2014-15 data will be captured in the system and will be entered by HQO. A couple more quick ones. Who can see my data? Only individuals who have registered and have access to QI wrap. So the HealthLink project sponsors, the LINs, ministry, and HQO. Can I delete my data? No, you can only edit your data as per the demonstration. However, if you do need to delete your data, contact our email address, the technical help at hlhelp@hqontario.ca. And last, when can I start entering my data? On April 30th, 2015, QI wrap will be launched, and data can be entered anytime after that. So as a reminder, please remember to log in and use the information you received recently. If you have not yet received that information, please email hlhelp@hqontario.ca and you'll receive your login and password information. Once you've successfully logged into QI wrap, enter your data for Q4, so that's the data from January 1, 2015 to March 31st, 2015 by May the 8th. And using the dates on the screen for the other quarters coming up in the year, so Q1 data by July 31st this year, and Q2 data by October 30th of this year as well. So we understand that this is a new program for people to enter and view data, and there is a learning process, and you may be looking for some support. And so we've created the written documents, both the user guide and the frequently asked questions. We are recording all the webinars. We have people in the field to help, and we also have the helpline to assist you as well. The recording of the webinar and the user guide will be posted on the website once they're translated into French. But in the meantime, if you'd like a copy in English, please email. And most importantly, you do have access to a QI specialist like myself and the others who have been on the line, who's knowledgeable in data entry and viewing the reports. So please contact them about any questions you may have about entering or viewing data. This is the list of QI specialists that have been sent out previous and will be included in the slide deck as well. It's for the QI specialists across the province, and you'll notice that each QI specialist is assigned to one or more LINs as your contact person. we'll take some questions at this point if there is any, Terry.
No questions at this time. So again, a reminder, if anyone on the line does have any questions, they can just type it in that question box and we'll share it, but
Okay.
There's none at this time.
So just in summary, using the data to support health links will provide system-wide data analysis. It'll allow the reports to be updated automatically as the data is entered. And in terms of transparency, the sharing of that data across the health links and LIMS will provide an opportunity to identify and connect with high performers and facilitate sharing and interlinked learning across the province, as well as accelerating the adoption and spread of best practices and innovations. So the QI specialists living in your region are available to work with your health link intensively as new health links ramp up and support the spread of best practices and measurement going forward. They are a resource to you and your health link during the period of QI wrap onboarding as well. We will be sending out a short evaluation post-webinar and would request that you would fill it out and send it back to us on the webinar itself. We do thank you for participating in the webinar today. And if you would like a copy of the user guide, please email at hlhelp@hqontario.ca. And we look forward to receiving the data from the LIMS and the health links. Thank you. Any other questions, Terry, before we leave?
No, that's it. So last call for any last-minute questions. And if not, then I guess we are done our preview.
Okay. Well, thanks very much. Thank you very much.